Hi, I'm Ethan Kuperman, academic hospitalist, and I'm here today to talk about the University of Iowa Hospitalist Group. Since our founding in 2000 with 2 physicians, we've grown to cover 60 employees, 40 FTEs, and about a quarter of all admissions to the University of Iowa hospitals and clinics. But in addition to our clinical mission, we've grown in our educational and quality improvement missions as well. From an educational standpoint, we've always had bedside teaching, but now we have residents and medical students available on the vast majority of our 13 service lines. And in addition, we cover preclinical educational roles and also curricular design for our internal medicine residency program. From a quality improvement standpoint, there are 3 major initiatives going on right now. The first is our patient regionalization initiative. As a 700-bed hospital, as you can imagine, we have patients scattered across about a third of a mile. And if we can limit the number of different wards that each individual provider team covers, that allows for more face-to-face time and a better chance to deliver comprehensive care to our patients. We were successful in doing this, and our initial implementation reduced length of stay by about 16 hours. So it was a big win for our providers and a big win for our patients, as well as a big win for our hospital as a whole. Our second initiative was the early discharge program. As the only provider of university-level tertiary care in the state of Iowa, we need to make sure that we have beds available to take care of critically ill and sick patients from all over the state of Iowa and parts of Illinois and Missouri as well. In order to better do that, our goal is to make sure that patients leave the hospital as soon as they're ready and in the best possible condition to do so. Our early discharge program identifies patients 24 hours before their anticipated discharge, allows us to get their pharmacy, nursing, and educational orders lined up so that those patients are ready to go first thing on the day of discharge, and so that they are as well prepared as possible for their transition from inpatient to outpatient. Our final program is the one that I'm most proud of. As the medical director of the Virtual Hospitalist Program, I've seen to it that we can provide our same high level of hospitalist care, not just within the walls of our Iowa City Hospital, but to community hospitals throughout the region. Using new advances in telemedicine, we're able to interact directly with patients in their community hospitals, in those community hospitals where they can be surrounded by their friends, their family, and the providers who have known them before their critical illness. It allows us to deliver not just the same level of care that they could get in Iowa City, but because of that social situation, even better care. And it means that when those patients do need to transfer into our hospital for a diagnostic test or a procedure that wouldn't otherwise be available, we can make sure that those patients have a seamless transition between the different institutions to provide the best possible experience for the patients and the providers, both when they come into Iowa City and when they discharge back to their home communities. Overall, I'd like to welcome you to Iowa City. It's a great community, we've got a great program, we're growing, and we're excited to bring you on board. So thank you very much for your time.